And welcome to the show. Subscribe at kevinmd.com/podcast. Today we bring back Wael Saasouh, Lisa Scardina, and Kim Downey. Wael is a anesthesiologist, Lisa is a healthcare executive, and Kim, of course, is our physician advocate who brought everyone together. Today we're going to talk about artificial intelligence, the role of AI in improving healthcare, artificial intelligence, and appreciative inquiry. Everybody, welcome back to the show.
Thanks, Kevin.
All right, Kim, as always, we'll start with you. So I'm not going to ask you how we brought everyone together because we talked about that last time, but the role of AI. So how did this topic come up with everyone here?
I interviewed Wael and Lisa for my own YouTube channel, and we talked about so many things during that episode, and this came up, and that's how we ended up with both of the articles because there were so many good nuggets in our conversation. It was too much for one article, so we divided it into two.
Perfect. So what do you guys talk about during your show? As you know, AI has its tentacles in so many different aspects of healthcare. So what were some of the highlights when you talked to them?
Well, I thought Wael had some great points about the ways that AI that I hadn't been directly thinking of. I had more thought of it in regards to making things easier for physicians, when they're with patients. But he had brought up things like direct recognition, gamify reward systems
Hmm.
and employee education opportunities and fostering collaboration and research and academic advancement. And I hadn't really thought about any of those things before our conversation.
All right. So I'm interested in hearing everyone's perspective. So we're going to talk about appreciative inquiry and its intersection with AI. So Lisa, tell us more about that.
Yeah, I think there's a really interesting, obvious play on words between AI as artificial intelligence and AI as appreciative inquiry. I have a certification from Case Western Reserve University and have really enjoyed getting to know more about that model. And so, the idea about asking positive questions really is a marker of a high performing team and really taking a strengths-based approach to working in teams. And so when Wael was sharing some of his thoughts about kind of the technology solutions in the ways that Kim just mentioned, it was just a compliment to what he was speaking to when thinking about, so how does this land with people? That's the work we're doing and the conversations we're having with our teams to understand technology, think about the implications and opportunities with technology, but to do so in a way that really thinks kind of works from where a team is at and how to ensure that there's a healthy culture within the team as we think about some of these technology implementations.
So Lisa, give us some examples of some of these positive framing of the intersection between AI and healthcare.
Sure. And so it's interesting too that this model comes out of Case Western Reserve, based out of Cleveland, and the original research was done at the Cleveland Clinic. So it really has its DNA in the healthcare setting, and that ultimately it's the classic when a team is looking at a scorecard in terms of performance. We have a human kind of habit of looking at the reds on the scorecard and thinking, okay, there's a deficit mindset. What's wrong with the situation? And when you're doing that, teams back up and say, yikes, I don't want to be part of, that's a hard conversation to have. What if we look at the greens on the scorecard and say, what's going well here? Where is the strength in this group? What, and we know that high performing teams, it's 3-to-1 or 5-to-1 positive to negative comments. So for me, in a really practical way, both with my group and as well in the physician recruitment space that I work, those cultural underpinnings about whether teams are leaning in and there's a positive environment, teams have a sense of what their strengths are able to name those strengths. It's a little bit of that hard to put your finger on cultural piece, but it really is around, is this group really having a positive mindset or a deficit mindset? And I think that's a little bit of what Wael was talking about too in kind of our previous conversation and continues to speak to from his perspective.
And Lisa, are you seeing that with the adoption of AI, how are most of your clinicians approaching that? Are they approaching that with a growth mindset, an open mindset, and excited about its implementation, or is it more from a deficit side? What are you seeing?
Well, I think what I see from the artificial intelligence side of AI, of what you're speaking to, and again, sitting in this physician recruitment space between, hundreds of different practice settings and thousands of physicians and providers, I think that there's a curiosity there about
Hmm.
the opportunities that, we have in healthcare with the application of AI. I think that the most important thing that happens, especially during kind of the recruitment process or as physicians or APCs are looking at new practice settings, is that cultural piece. Is this a healthy culture? How do you describe the culture? How are decisions made? How is the team interacting with each other? And that's where that appreciative inquiry, strengths-based approach kind of shows up for me.
All right, well, so what Kim said earlier in terms of right now how we're using AI, a lot of it is these AI scribes, right? How to make our jobs easier. But of course, the potential of AI goes much, much deeper than that. So tell us about the ways that you're seeing AI infiltrate our healthcare space.
I think this can be split into two sides of the argument. One side where we focus on how AI can help, and other ways, and the other side is how AI can hinder work. Because some of the fears of let's talk about clinicians since that's the topic. Some of the fears of clinicians of introducing AI technology into the clinical day-to-day work is that, well, now we're more efficient. Are we supposed to be doing more? Are we supposed to see more patients to cover the expense of including AI or similar technologies in our care? Which we tend to see some of the thought processes going that direction in some places. And that automatically makes people who are already hesitant to adopt these technologies, make them even more fearful of them because, oh, great, now I have to work more and I have to see more patients. So we have to keep that in mind. The other way is how we can utilize this technology to advance care and to relieve some of that burnout that we talked about last time. Think about a game reward system where people have achievements and they have rewards and they have points. Again, going back to what Lisa was saying, the culture matters a whole lot, because if that system becomes an unhealthy competition, then it's not working towards what you want it to work towards. What you want to do is you want to get people involved, get people to adopt that technology and then see the good in it, and then see how it can help them as individuals and them as a team, and then go from there. So if you have something like a reward system where the rewards don't necessarily mean that you get promoted, but they mean maybe you get an extra something you've been wanting to get in your office, or if you say you're interested in a certain aspect of what you do, you want to specialize in it, you want to get some training in it, say that covers your training. Your employer can cover your training if you get to a certain achievement. Things like that. As long as it gets people involved and gets people talking to each other, then it's more of a healthy competition, and it kind of promotes the advancement of everybody as a team. But you can't just pick this up and introduce it into a culture that doesn't support this. So I would start straight from the culture and then start introducing these additives.
So, well, that's a great point. I think that the culture certainly matters, and that's what we're having this discussion here. That point about these AI scribes increasing productivity, but then eventually clinicians are going to be forced to see more patients to pay for this. That is very salient, and I'm actually seeing that in other systems as well. So, Wael, talk to me about how we can prime the culture to be more appreciative in terms of taking that growth mindset to adopting AI. What are you seeing? Are you talking to administrators in order to prime them for that approach? Or what are you seeing in your system or other systems?
These conversations are ongoing constantly. And most of the time, they're informal conversations, because these topics come up in almost anything that we talk about. Going back to a focus on culture, we have to start by focusing on what's happening and what's happening well, and how is our team strong? How is our team productive? How is our team connected? Obviously, all of this doesn't work if the entire team is burnt out, whether it's clinicians or administrators. This all feels like a luxury that we can't afford. So we start by addressing baseline issues where, do you think that you're happy where you're working? What's making you happy? What's not making you happy? Let's work on a few of those things first, which is pretty much what Lisa does. And then we start adding layers to that. So for example, people are okay where they're working and they feel like they're just disengaged. Introduce the gamified reward system or some version of it, and say, okay, so let's boost performance a little bit while keeping it light and productive. And then we go from there. If you start from a place where the culture is really down, the morale is down, then start from there. Address the morale first, and then start adding layers to it. If a place is overproductive and they're doing great, then you can introduce the technologies and the reward system to kind of lighten the mood a little bit, to just make them happier to be where they are, not just forced to keep producing the whole time.
So, Kim, after hearing the perspectives of Wael and Lisa, so how has that changed how you feel about AI in healthcare?
Well, I'm someone, I'd call myself a technology dinosaur. So I'm kind of fearful myself. So hearing the things that Whale said makes me a little more open-minded about it myself. And also bringing to the point, what Lisa said is, that we have to involve people, and just the positive aspects and what's going well and what's going right. And we can't approach it from a punitive standpoint. And I'm thinking about when we were first introduced to the EMR. I was working in a nursing home and they said, oh, it's going to be more time for your patients, less time on paperwork. And that was the biggest lie ever. So as we're approaching this, we also have to be honest, and you have to be honest with your team.
And Kim, I know you talk to a lot of physicians who are burnt out. Are you seeing AI make a difference? Are you seeing that AI, these scribes, for instance, are they moving the needle for some of these physicians who were previously burnt out?
I think it's still mixed. I
Hmm.
think it's still, I do. It
Yeah.
just seems to be mixed. That some are able to use the scribes and then others are still fearful.
Well, and I might say too that my lens within kind of healthcare operations is that maybe sometimes we take a grand definition of what AI is, when in fact there's lots of small efficiencies that are happening, that are aided by some of these kind of the definition of artificial intelligence. We've got a lot of that already kind of embedded in some of our workflows and some of our operational efficiencies. And so I think there's this opportunity for the larger ways that AI could come into a practice setting and the ways that Wael is talking about. And, what I see, bright spots within the different organizations I'm working with is when we have physician leaders able to step up, work with a team, kind of promote new ways of doing the work, given the physician shortage that we're faced with, given the technology opportunities. Again, where are those bright spots inside of an organization where we actually see a physician leading an initiative to say, hey, let's do this work a little bit differently, whether it's team-based care or augmenting with some technology. What are ways, like you said, Kim, I think the electronic medical record is a real riddle, but what are some of those efficient ways that we see good work happening there, and how do we build on those opportunities is a little bit of what I think about too.
And Lisa, are administrators that you're seeing, are they taking that open-minded approach? Are they listening to those tenets of appreciative inquiry? What are you seeing?
Well, I think, over my 20-year plus career in healthcare, I do see the physician voice coming into leadership differently, and that's exciting. And I think that there is more of, especially given the complexity that we see with the amount of information that's out there, how do we become more of a learning organization so that we can take physician leaders who are making recommendations, and that there are new structures that I'm seeing of medical group boards or otherwise, so that that decision making can happen with a physician voice at the top, and really put a bright spot on some of the good work that's happening. I think that that does shift the thinking a bit to just have that voice and perspective at the table differently. So I think, again, that's my bias, is to kind of look for the bright spots, and how to tell those stories, because we all know that there are so many gaps and deficits that contribute to the burnout that we're speaking to.
You can't call all of AI good or bad, and you can't call all of AI that it works or it doesn't work. You have to really fine tune what you want from it. You have to ask very specific questions, and you have to apply to very specific scenarios. And it's very interesting that we're seeing a whole lot of advertising for AI in medicine specifically. We're not seeing a whole lot of experience or feedback on the use of AI, which goes back to your points, Kevin and Kim. It's there, but we don't know if it's being used appropriately, and we don't know if it's helping as much as we'd like.
And well, if you were advising administrative leaders at healthcare institutions when it comes to adopting AI, and I'm sure they hear a lot about that AI hype, tell them the type of questions they need to specifically consider before they try to implement it within their healthcare systems.
If you've ever run any search on an AI engine, you know that you can get all sorts of responses to the same question. So it's all about defining your parameters. So if somebody in administration asks me, should I get AI or not? My first question would be, what do you want from it? Where do you want to apply it? Be as specific as possible. Because if you're trying to apply it to increase your revenue, then fine, you can go do that with a billing system. If you're trying to apply it to increase morale, that's a very different thing, and it's a very different subset of skills that you want from that AI. So know what you want, know your why. We go back to the same question, and figure out how that plays into the culture within your institution, because not everything works everywhere.
We're talking to Wael Saasouh, Lisa Scardina, Kim Downey. An MD article we're talking about today is the role of AI in improving healthcare, artificial intelligence, and appreciative inquiry. So I'm going to ask each of you just to share some take-home messages about AI to the KevinMD audience. We'll start with Lisa, then Wael, and we'll end with Kim. So Lisa, why don't you go first?
I would just encourage listeners to learn a little bit more about appreciative inquiry. It's really based in psychology. How we make decisions, how we interpret information really matters. And so as a leader, I have found it very valuable to just understand the basic tenets of how asking positive questions can help teams feel better. That's one small step on combating burnout. I just encourage a level of curiosity about this as a model, and the fact that it's based out of research that originated in healthcare at the Cleveland Clinic, I think gives it a little bit of credibility for this particular audience.
And Wael, what are some of your take-home messages?
I would say to everybody on either side of this to just maintain a sense of purpose and a sense of wanting self-improvement. And we all talk about altruism in medicine and how it's part of our core that we're there to help everybody else. Keep an eye on yourself too, because that's important. If you're not doing okay, then your patients won't do okay, or your employees won't do okay. And as much as technological as we get, simple gestures matter. Talk to somebody face to face. Smile at somebody, say thank you, say please, things that we take for granted that we don't see as much. And then you don't want technology and advancements to get in the way of that. So maintain a human aspect of what you're trying to do, and things will just fall in place.
And Kim, we'll end with you. What are some of your take-home messages?
Sure, I'll speak to both. So first, as far as artificial intelligence, I do see the potential to really help doctors, and I sincerely hope it happens. And I hope that no leaders then expect doctors to produce more as a result. Doctors need time with their patients, and they need time to think about their patients, and there's no substitute for this. And I fully understand it. As a PT, I had a caseload of 30 plus patients, and doctors have caseloads in the thousands. And I fully understand it as a patient. Patients are craving more time and more feelings of connection with their doctors, and no robot can ever replace human connection. And about appreciative inquiry, at the heart of it is improving communication. And we can all benefit from making an ongoing conscious effort to improve our communication skills. And personally, I continue to work on it, and I've seen a tremendous difference, most recently in relation to this week's election, where a friend and I, with differing political views, because we have a safe and trusting relationship, we're able to have a thoughtful dialogue that we both benefited from. And similarly, I talk to a lot of doctors, and I've consented to doing something as a patient next month that I really don't want to do. And I was sharing my perspective with a doctor who had just had a bad day. And I also listened to him, and I got to hear his perspective, and we both felt better afterwards. And our conversation will inform how I show up for an upcoming appointment with one of my own doctors. And it all matters, and it all makes a real difference. And I'll end with the concluding line of our article: artificial intelligence needs appreciative inquiry.
Well, thank you everyone for sharing your perspective and insight. And thanks again for coming back on the show.
Thanks for having us.